Hey everyone, this is Dr. Matt again with Eat Those Athletes podcast. We're here on episode 3 of our mobility series with Dr. Tom Padilla. So today we're going to go ahead and talk about shoulder mobility and what are some common movement restrictions that we see in shoulder mobility, what are the causes of those, and how can you figure out what's going on and get it treated. So Dr. Tom, welcome to the show.
Hey, thanks for having me again.
For those of you who haven't listened to the last 2 episodes, Dr. Tom is the owner of the Doctors of Physical Therapy, and he is a physical therapist. Obviously, if you captured that by the name of his business, graduated from USC, which is the #1 PT program in the country. So let's go ahead and start with tell me a little bit about the shoulder and the movement that people expect to see in the shoulder. This is probably going to be obvious, but it's always good to start with what normal is and then kind of build up from there.
Yeah, absolutely. So the most important thing to know about the shoulder is that it's a very mobile joint and that it's often unstable. So you need to be able to move the shoulder in all six directions if you're going by the 3 cardinal planes of motion. So it needs to go forwards, backwards, side to side, and then it needs to be able to rotate inwards and outwards. And often it's a combination of multiple planes of motion at the same time. Very rarely are you doing just things in just one plane of motion in life. Whereas if you're in the gym, you're more likely to be doing things that are in a certain direction. So when it comes to normal movement of the shoulder, you just want to see that somebody's able to move strongly through their entire range. So you don't want any range to be weaker than others, and that's where you're going to end up starting to have compensations.
Okay. Now, what are some common movement restrictions that you typically see in the shoulder?
The biggest one is internal rotation. So somebody notices that they can't scratch their back between their shoulder blades anymore, or for the ladies, you can't put on a bra or do anything like that. So that's the biggest one is shoulder internal rotation, reaching the hand behind the back.
And what does this translate into when we're looking at CrossFit movements? What are some of the movements that get impaired by this?
So for internal rotation, you need a healthy. So if your internal rotation is restricted, there aren't a lot of movements that require specific internal rotation. Unless you're doing like an upright row. However, which you also need that for when you're doing like a power clean or anything that you're going to snatch over your head. So I guess there are a few, but what happens when you have an internal rotation deficit is if it's the external rotators of the shoulder that are having an issue, they're going to be causing more compression in your shoulder even when you're at rest. So having that extra compression in your day-to-day activities can set you up for having increased grinding or dysfunctional movement patterns when you're performing any shoulder movement.
Okay. And what are some of the causes for it you said are the external rotators, right?
Yeah.
Okay. Are there any other issues that can occur in the shoulder that causes that internal rotation to decrease?
Absolutely. So the capsule can become a little less mobile. So the capsule is basically bunch of connective tissues that surround the shoulder joint. You can think of it as like a saran wrap that surrounds the shoulder joint, but that saran wrap should be mobile and allow the shoulder to move in all directions. And sometimes the inflammation, whether it's caused by the muscles or caused by the joint, can just cause that capsule to become a little less mobile, so the shoulder can no longer spin and glide and roll the way that it's supposed to.
Okay. And what are some diseases, or what are some diseases that can cause that capsule to...
That sounds pretty harsh. Diseases.
Yeah. I know, it does.
But I think you're getting at adhesive capsulitis.
Yeah.
Yeah, that would be a big one.
That'd be a big one for sure.
Yeah, that definitely causes that. I haven't seen a lot of CrossFitters with adhesive capsulitis, but I mean, it's definitely a possibility if they're in the right age bracket and demographics.
Okay. And aside from internal rotators, so you said one way to test that at home would be if you're a woman and you have to unclasp your bra or clasp your bra, then if you're unable to do that, then that's going to be a sign of an issue with internal rotation. What are some other things that people can notice if they have decreased internal rotation in their shoulder?
Yeah, well, so if you put your hand behind your back, you should be able to touch your opposite shoulder blade at least with your fingertips. And usually if you're unable to do that, then you already have significant range of motion deficits. Another one is if you put your hand behind your back in order to do that, and the only way that you do that is by letting your shoulder blade wing off your back. You can't really see it if you're not using a mirror, but if stand in front of a mirror, so if it's your right shoulder, stand in front of the mirror with the mirror to your left and reach that right hand behind the back, and then look in the mirror and see if your shoulder blade is actually peeling off of your back in order to get that to occur.
Okay. What are some things that people can do at home to improve their internal rotation?
So temporary improvements, you can get those with a lacrosse ball or a foam roller. Use a lacrosse ball against the wall or on the floor. Really target the infraspinatus and teres minor to try to get those to loosen up. So you sit on them for maybe 30 seconds at a time and just increase that mobility temporarily. And I say temporarily because if there is a reason that those muscles are tightening up because they're trying to guard or protect from some other injury process that's occurring, then it's only going to last a short period of time before they guard again.
Yeah, so keep in mind in our last episode when we talked about common mistakes, we talked about working on a muscle that is tight or has a length issue compared to working on a muscle that's guarding to protect an instability that you have going on. And so Dr. Tom had mentioned if you are having to constantly go and mobilize a given area and it's just doesn't seem to be getting better, you're doing the same thing over and over, it's likely because there's an instability problem that needs to be addressed. Now, you mentioned going and putting a lacrosse ball on the infraspinatus and teres minor for people that don't know exactly where that is. Can you go ahead and describe the location of those?
Yeah, that's a tough one. I mean, even the people that I describe it to visually, like with pictures, have a hard time. So basically, if you want to take your left hand and reach over your right shoulder and feel for the bump that's in the middle of your shoulder blade, that is the spine of your scapula. That bump should be running pretty much horizontally out towards your shoulder. And then below that is going to be the infraspinatus. And then to the outside of your shoulder blade will be the teres minor. So if you're trying to get these, you're not going to have a lot of luck if you put your back flat to the wall and pin the lacrosse ball between them. You're going to actually have to angle yourself off to the side a little bit.
Okay, and probably like a 45-degree angle and put your shoulder that you're working on mobilizing up against the wall.
Yes.
Okay, perfect.
Yeah.
So the those muscles are right at the bottom part, if you will, of the shoulder blade, and infraspinatus is fairly big. I mean, if you're on the shoulder blade in most places, you're going to be on the infraspinatus, but teres is a little bit harder to get to.
Mm-hmm.
Obviously, the alternative would be to go see a massage therapist and have them work that part out, and you probably won't like that massage therapist temporarily, but it'll they'll get you where you need to go.
Be a love-hate relationship.
Yeah, absolutely. So aside from internal rotation, what are some other mobility issues that you see?
I mean, the next one would be external rotation.
Okay.
But a mix between that and just not having the right lat length for some overhead movements, especially as you get into overhead squats and snatches, you need a lot of overhead ability with your shoulders, and a lot of people come in with decreased lat length, which over time causes them to overarch their back. So that would probably be the second most commonly seen. Okay. External rotation or shoulder flexion.
Okay. And for checking lat length, I know that's a little bit tougher one for people or for us to describe over, so what, maybe we'll have a video in the show notes to kind of show how to do that. But what's the best way that you found to look at lat length? And
yeah, I mean, I love having people just flatten their back against the wall, stand with your back to the wall, put your pelvis on it, make sure your mid back is touching, and then bring your low back to the wall by just pelvic tilting backwards, so you activate your abdominals. Then you put your head on the wall, make sure that you're not extending your neck, and reach up and see if you can get your wrist to touch the wall. So your whole spine, from pelvis to low back and thoracic spine, and then the back of your head are all touching the wall, and you have to maintain that as you reach your arm up and over your head to try to touch the wall with your wrist. Okay.
And a good way to make sure that your spine is touching is you could also put a PVC pipe behind your back, correct? Because then that could also, if your back arches, then that PVC pipe will drop down.
Yeah, you could try pinning it there.
Yeah. So that's one way to check it. Now, if if this is a problem for somebody, if they have a lat issue, you said it's typically lat length, correct? That's the lat is too short.
Yeah, it's so it could be short or it could also be stiff.
Okay.
Yeah.
So what are some ways to work on that at home?
My favorite way is a foam roller.
Foam roller?
You know, get it off to the side of your rib cage and work all the way down to where the rib cage ends. I wouldn't go too far into the lower ribs, just because it's a lot of weight to put on some floating ribs down there, and the lat at that point is more of the tendon and fascia and less of the muscle belly, which is what you're really trying to get at when you do foam rolling.
And when they reach the top of the lat, is their arm over their head, or where's their arm position?
Wherever's most comfortable. If they can tolerate over the head, that would be good. If you pin the lat with the foam roller and then you move your arm up and down, that's really aggressive, and people love to hate it.
Yeah.
So
yeah. Working on your lats is definitely not a pleasant experience. That's for sure.
Nope.
Yeah, that one completely sucks. I hate that one. All right, and then you also mentioned external rotation, which has to do with some of the lat length. Are there any other things to consider for that?
There are a lot of things, because I mean there are 17 muscles that attach to the shoulder blade. So
right.
If you're talking about external rotation, it could be pecs, could be subscap, it could be teres major that's affecting that. It could be a weakness of the external rotators. So that one gets pretty in depth.
Okay.
There.
Now, one thing to consider as well is when someone's having shoulder mobility issues and there's pain associated with it, that would probably be a good time to go and seek the advice of a healthcare professional, correct?
Yeah, absolutely, especially because it is so complex.
Yeah, so I know one of the things that I see most common in CrossFit, in CrossFitters, is going and they either have some sort of bursitis going on in their shoulder, which limits their mobility quite a bit, or more importantly, they have some sort of rotator cuff injury that can really cause pain and weakness in those muscles. So there's different things you want to look at when you're dealing with the shoulder, and pain, weakness, and mobility are all different things, and that some of them will go and tie over, and correlate with each other. But at the end of the day, a mobility problem doesn't necessarily mean pain, and those are just some things to consider. And there's a lot of people that will go and have pain at night when they're trying to sleep, and they have pain in their shoulder, and that should not ever be the case. If you have that going on, there's something serious going on. You need to have that checked out. So are there any, when it comes to shoulder mobility, what are some other things that you see shoulder mobility affects? Like, does it travel to the thoracic or the mid back area? Does it travel to the elbow? Are there any other things that you see correlate with decreased shoulder mobility?
Yeah, it can go up and down the chain, absolutely. So like if you don't have the right amount of range of motion due to your lats, a lot of people are going to end up extending through the lumbar spine. Or if you don't have enough shoulder extension when you're up over your head, you're going to, again, end up extending through the lumbar spine to try to keep your chest more upright, to get those shoulders behind you. And then if you don't have the right amount of rotation in the shoulder for a front rack position, you're not going to get your elbows in the right position. So you're going to end up yelling at your wrists and cranking your wrists back into extension because you feel like that's your weak point. So it can definitely cause a variety of issues. It's one of the most important joints in the body.
Yeah, absolutely.
For CrossFitters and just people.
Yeah, also one of the
human experience.
Yeah, also one of the main joints is injured when it comes to CrossFit as well. So that's something to be careful with. So just to kind of recap a little bit on what we've talked about, one of the major problems that is seen in shoulder mobility is internal rotation. That's usually a result of issues with the infraspinatus and teres minor. Some ways to see if you have that yourself is, are you able to reach your mid back by bringing your arm behind your back and trying to scratch in between your shoulder blades. If you're female and you wear a bra, having an issue clasping or unclasping the bra can be a sign of decreased internal rotation. You can go and take a lacrosse ball and work on the infraspinatus teres minor, see if that gives you some relief. If it's temporary, then you probably have a little bit more stuff going on, such as an unstabilized structure. And then when it comes to external rotation or lat length, you can have an issue with that. One way to fix that is to do foam rolling on the side. You're not going to like it. I'd be surprised if you'd like it.
Sadistic.
Yeah, absolutely. And so but that's a way to address that part. Mobility and pain and weakness are all different things. So if you're experiencing weakness in any of your muscles or in any of your movements, then you need to get that checked out, and as well as pain. I mean, at the end of the day, you shouldn't be in pain. So make sure you seek a healthcare professional when you are experiencing those things. That way they can kind of properly diagnose what's going on and make sure it's nothing serious. I mean, if it is just strictly shoulder mobility and just muscles being shortened or tight, then obviously they can work that out, or you can work that out at home. But if there's more to it, then you want to be sure to catch that before you injure yourself even more. Dr. Tom, is there anything else you'd like to add?
No, I think that was beautiful.
Awesome. Well, thanks for listening, and we'll see you on the next episode. We're going to be talking about hip mobility. And until next time, catch you later.